So, the topic of the day is pharyngeal arches. In some books and by some authors, the term branchial arches is still used. So, the first question is whether we should use the term branchial arches or should we say pharyngeal arches? Well, branchial arches, they give rise to the gills in fishes, and these gills, they help in the exchange of oxygen and carbon dioxide between the blood and the water. So we don't have the gills, so it's better to call these arches which appear in the lateral wall of the pharynx in the 4th to 5th week of intrauterine life as pharyngeal arches and not branchial arches. So we are going to use the term pharyngeal arches for these mesodermal thickenings, or we can also say branchial apparatus. So I'm Dr. Gaurav Agnihotri, and I'm going to start my topic, pharyngeal arches. So what are these pharyngeal arches? As I mentioned, they are mesodermal thickenings which appear in the lateral wall of the pharynx. They are covered on the outside by the ectoderm and on the inside by the endoderm. So initially there are 6 thickenings on each side in the lateral wall of the pharynx. The 5th thickening disappears so that we have to study only 5 thickenings, and we call them the first arch, second arch, third arch, 4th arch, and 6th arch. So these mesodermal thickenings are there in the lateral wall of the pharynx, and they appear in the 4th to 5th week of intrauterine life. Now, neural crest cells, they migrate into these mesodermal thickenings, and most of the connective tissue and bone of the head and neck, they are formed from the neural crest cells. So that is of neural crest origin. So the muscle and the vasculature, that is of the mesodermal origin. So each of these mesodermal thickenings is invaded by neural crest cells, and these mesodermal thickenings have got some components and they have got important embryological derivatives. So, derivatives of the pharyngeal arches. Each pharyngeal arch contains a skeletal element. So cartilage may be there, and this cartilage may later get converted into bone. So bones are formed from each pharyngeal arch. Each pharyngeal arch gives rise to striated muscles, and they are supplied by the nerve of the arch. Now, mostly the nerve is there, single nerve is there in the arch, but in lower animals, some of the lower animals, they have got a double nerve supply of the arches. And we human beings have got a double nerve supply in case of the first arch. The nerve of the arch lies along the cranial border of the arch and is called the post-traumatic nerve, while the nerve of the next arch lies along the caudal border of the arch, and that is called the pre-traumatic nerve. So in human beings, the double innervation for the striated muscles is seen only in the first arch. The next component of the pharyngeal arch is the arterial arch. So each pharyngeal arch contains a skeletal element, a striated element supplied by nerve of the arch, and it also contains an arterial arch. So you can see in this diagram the nerve of the arch. So the first arch has got a double innervation. So the original nerve of the arch lies along the cranial border, that is the post-traumatic nerve, while the pre-traumatic nerve lies along the caudal border, and it is actually the nerve of the succeeding arch, that is the second arch. So this is seen in case of the development of the tongue. Tongue is derived, the anterior 2/3 of the tongue is derived from the first arch. So it has got a double innervation. So it is supplied by the mandibular nerve, and it is also supplied by the cauda tympani branch of the facial nerve. So lingual nerve, a branch of mandibular nerve, supplies the anterior 2/3 of the tongue, and it is also supplied by the nerve of the succeeding arch, that is the pre-traumatic nerve, that is the cauda tympani. So now we do the derivatives of each pharyngeal arch, and students, this first pharyngeal arch is very important. It is mostly asked in the examinations. So the first pharyngeal arch is also called the mandibular arch, and the nerve is the mandibular nerve. So what are the skeletal components arising from the first pharyngeal arch? So the cartilage of the first pharyngeal arch is called Meckel's cartilage, and the dorsal part of this cartilage, it develops into the two ossicles, the malleus and the incus. Yes, and then the part of the cartilage extending from middle ear to mandible disappears, but its sheath forms the ligaments, that is the anterior ligament of malleus, which is attached to the malleus, and the sphenomandibular ligament, which starts from the spine of sphenoid bone. So coming back to the skeletal elements derived from the first pharyngeal arch, we have got the two ossicles, malleus and incus. We have the mandible, the maxilla. So we have the lower jaw and the upper jaw, the premaxilla bearing the incisor teeth, the cheekbone or the zygomatic bone, the spine of sphenoid, and the palatine bones, along with the squamous part of temporal bone. So out of these bony components derived from the first arch, you see we have the ligament of the malleus, which is attaching to the malleus. This is also a derivative of the first arch, anterior ligament of malleus. And from the spine of sphenoid, we have the sphenomandibular ligament, which passes from the spine of sphenoid to the mandible, which is also a derivative of the first arch. Now, what are the muscles derived from the first arch? There are 8 muscles. So we have the 4 muscles of mastication, the temporalis, the masseter, the lateral and medial pterygoids, and then we have the mylohyoid and the anterior valley of digastric, tensor tympani and tensor veli palati. So you remember, students, that the soft palate muscles are actually derivatives of fourth arch, but this tensor veli palati is the exceptional muscle. This is supplied by the nerve to medial pterygoid, a branch of mandibular nerve, and it is derived from the first arch. So tensor veli palati is the exceptional muscle of soft palate, which is derived from first arch, and in total there are 8 muscles which are getting derived from the first pharyngeal arch. Second pharyngeal arch is called the hyoid arch, and the nerve for this arch is the facial nerve. The cartilage for this arch is the Richards cartilage. Now, an interesting thing is that all these skeletal components derived from the second pharyngeal arch, they begin with S. So we have got stapes, the smallest bone in our body, the styloid process, the smaller cornu of hyoid bone, and the superior part of body of hyoid bone. So, body of hyoid bone has got a superior part, and laterally extending from the superior part are the lesser cornu of hyoid bone. So the remaining components of the hyoid bone, you see the greater cornu of hyoid bone and the inferior part of hyoid bone, they are derived from the third arch, while the S components of hyoid bone, the smaller cornu, superior part of the body, along with the smallest bone in our body, stapes, and the styloid process, they are derived from the second pharyngeal arch. Now, what are the muscles which are derived from the second pharyngeal arch? Well, we have all the muscles of facial expression, and then the smallest muscle in our body, the stapedius. So the smallest bone in our body and the smallest muscle in our body are derived from the second pharyngeal arch. So stapes, and attached to stapes is the stapedius muscle. So again, the muscular derivatives of the second arch, all the muscles of facial expression, stapedius muscle, posterior belly of digastric, and stylohyoid muscle. So anterior belly of digastric is the derivative of first pharyngeal arch, while posterior belly of digastric is a derivative of second pharyngeal arch, and it's supplied by the facial nerve. And the stylohyoid muscle and the stylohyoid ligaments, both are derivatives of the second pharyngeal arch. Now we come to the third pharyngeal arch. I've already told you the bony components. You can remember them by the word LG. So we have the lower part of the body of hyoid bone and the greater cornu of the hyoid bone. And then the exceptional muscle of the pharynx. All muscles of pharynx are supplied by the pharyngeal plexus, but the stylopharyngeus is supplied by the glossopharyngeal nerve. And students, this glossopharyngeal nerve is the nerve of the third pharyngeal arch. So the muscular component derived from the third pharyngeal arch is the stylopharyngeus muscle. So for the fourth arch, you remember, this is supplied by the superior laryngeal nerve, and it supplies all the muscles of the soft palate, except I told you the exceptional muscle, the tensor veli palatini, which is derived from the first arch. And then it compensates for that it is not supplying the tensor veli palatini, it supplies the exceptional muscle of larynx, the cricothyroid muscle. So cricothyroid muscle and all intrinsic muscles of soft palate, they are derived from the fourth pharyngeal arch, along with the two important big cartilages of the larynx, the epiglottis, and the thyroid cartilage. The third important cartilage of the pharynx, that is the cricoid cartilage, is derived from the sixth pharyngeal arch, and small cartilages of the larynx are also derived from the sixth pharyngeal arch. The nerve of the sixth pharyngeal arch is the recurrent laryngeal nerve, and so the sixth arch supplies all intrinsic muscles of the larynx except the cricothyroid muscle. So now we have got the pharyngeal arch arteries. So most of the books say the first and second arch arteries don't give rise to any structures, but this is not true. The first arch artery gives rise to the terminal branches of maxillary artery. The second arch artery gives rise to the stapedial artery in embryos and caroticotympanic artery in adults, which supplies the tympanic cavity. The third arch artery gives rise to the common carotid artery and proximal part of internal carotid arteries on both the sides. And then the fourth and sixth arch arteries also give rise to important structures. We'll do them with the help of this diagram. So here you see, we all know that the branches of the arch of aorta are the brachiocephalic artery or brachiocephalic trunk, and then the left common carotid artery and left subclavian artery. So here you see that the right horn of the aortic sac, this gives rise to the brachiocephalic trunk. And the left horn of the aortic sac gives rise to the arch of aorta. So arch of aorta is formed by the left horn of the aortic sac along with the left fourth arch artery. So from here till here, you have got the arch of aorta, and this seventh cervical intersegmental artery forms the left subclavian artery. So from the left horn of aortic sac, you've got continuity with the brachiocephalic trunk, which is formed by the right horn of aortic sac. And this brachiocephalic trunk, it gives rise to the right common carotid artery, which is lying here, and the right subclavian artery, proximal part of right subclavian artery. This is the bud for the external carotid artery. So the right third arch artery gives rise to the right common carotid artery and the right internal carotid artery, proximal part, while the right fourth arch artery gives rise to the proximal part of right subclavian artery. On the left side, the left horn of aortic sac, it gives rise to the arch of aorta along with the left fourth aortic arch. So this seventh cervical intersegmental artery gives rise to left subclavian artery, while on the left side, the third arch artery is giving rise to the left common carotid artery and left internal carotid artery. So this is the bud for the external carotid artery, and the portion between the origin of the left common carotid artery and left subclavian artery, that portion of the aortic arch, it is derived from the left fourth arch artery. Now if you see the sixth arch artery, on the right side, the sixth arch artery forms the pulmonary artery. This is the bud, lung bud. And on the left side, the sixth arch artery, it forms the left pulmonary artery, and from the pulmonary bud to the dorsal aorta, we have got the location of the ductus arteriosus, which forms the ligamentum arteriosum in later life. So students, you must appreciate the structures contributed by the third, fourth, and sixth arch arteries. It is much easier if you remember that the brachiocephalic trunk gives rise to the common carotid and subclavian artery on the right side, and then you have got the origin of left common carotid artery and left subclavian artery, and this portion forms the arch of aorta. So the left fourth arch artery gives rise to the portion of arch of aorta between the left common carotid artery and the left subclavian artery. And truncus arteriosus has divided into ascending aorta and the pulmonary trunk, and from the pulmonary trunk are arising the right and left pulmonary arteries. So with this, we complete the branchial arches. Next time we meet, we'll be doing the ectodermal cleft and the endodermal pouch derivatives. And till that time, I implore you to enjoy your academic journey. So this is Dr. Gaurav signing off. Thank you.